In this module, we explore the need for clinical research data warehouses. The range of data that could impact a patient's health is enormous. This figure from an article by Griffin Weber at Harvard University highlights the large number of data sources, including traditional data collected during interactions with the healthcare system, but it emphasizes that these data are really just a small part of the ecosystem which impacts our health. The diagram includes data from home and work, environmental and social resources, alternative treatments and medications. He includes data from social media sources, grocery store purchases, and employee records. While we do not have the means to bring all these data together for medical research, this diagram is a reminder that there are a large number of influences that we may not be including in our analyses. Zooming into the middle of the diagram focuses on data elements found in traditional clinical care settings. Even in this more narrow setting, we see a wide range of data elements that come from many different locations, including the clinical visit, the pharmacy and elsewhere, radiology and other images, laboratory tests, and now, more recently, genetic tests. The challenge for clinical research is how to organize these data from the different systems into a cohesive structure that supports real-world data analytics. This diagram represents the complexity of the data systems environment in a single hospital in the United States. While this diagram is a generalized representation, a typical large hospital setting has hundreds of separate systems which are collecting or generating data that could be important in understanding a patient's illness. Data warehouses are not a new concept, having been used in traditional business settings for many decades. Bill Inman and Dick Hackathorn created this operational definition of a data warehouse. It is subject-oriented, which means objects contained in the warehouse have a direct relationship to real-world objects. It is time-variant, capturing changes in data values rather than overriding them with the latest value. This feature is important to ensure that the state of the world at any point in time in the past can be recreated. A related concept is that a data warehouse does not destroy data. It is an append-only database. So all data are stored permanently. And most important for our focus, a data warehouse integrates data from across the institution to provide a comprehensive and consistent view of the business. This is a high-level logical diagram of the Health Data Compass Research Data Warehouse that has been constructed at the University of Colorado. Health Data Compass is surrounded by systems that provide data, including research systems along the top, clinical and administrative systems along the bottom, and, reflecting the spirit of the earlier diagram by Griffin Weber, data sources from patient devices, regional, state, and national databases, and other external reference databases. The last feature of a data warehouse by Inman and Hackathorn is to integrate diverse data into a comprehensive and consistent view. The challenge is to determine how to store the data elements in the data warehouse. What are the tables and how are they connected? When combining data collected in different systems under different settings, the data warehouse team faces a myriad of decisions. But for data integration, the data warehouse team must decide when data elements represent the same concept and therefore need to be assigned a common name, when data elements refer to different concepts and therefore need a different name. We provide some examples here. In most settings, the word visit and encounter are used interchangeably. I happen to prefer the word visit, but other courses may use the word encounter. They represent the same thing. However, an appointment is different from a visit because an appointment may be canceled or rescheduled, features that are not relevant to a visit. An order to have some task performed is different than the results obtained by completing that task. And a prescription for a medication is different from a record documenting that the patient actually went to the pharmacy and received the medication requested in the prescription. Finally, data that are similar yet need to be distinguished have to be identified. We list here 3 different types of visits: a clinic visit, an emergency room visit, and outpatient surgery visit. These 3 concepts share many features and also have distinct features that need to be preserved. A database is an organized collection of electronic data stored and queried in a structured format. A very informal definition of a data model is that it is a document or a diagram that describes the key features of a database. Features such as which data elements can be stored, relationships that hold between 2 or more data elements in the database, and a number of technical features such as the data type, allowed ranges, whether a data element is required or is optional. In actual practice, a data model contains substantially more information than I just mentioned. Here we show as icons information that would be included in a data model. We have 3 types of objects: patients as shown on the left, providers as shown on the right, and visits as shown in the middle. In this diagram, it is clear that a visit involves 1 provider and 1 patient. What is also shown is that a patient may have more than 1 visit, as seen in the patient on the top, and that a provider may be involved in more than 1 visit, as the provider in the bottom. These relationships are key elements of a data model. This slide extends the previous slide to include icons representing multiple medications. In this model, medications were included as part of the patient's visit with her provider. This is an alternative data model where the medications are not associated with a visit, but is associated directly with the patient on whom the medications were ordered. Unlike the previous model, medications could be ordered without any associated visit in this model. We discussed the strengths and the weaknesses of the 2 alternative methods for representing the relationship between medications and visits and patients in later videos. A data model is important because it determines what data can be entered into or retrieved from a database. Because it also specifies features such as data types, allowed ranges, and optionality, a data model is a key factor in ensuring high-quality data. As we shall explore in more detail in later videos, there is no one single data model that is best in all settings. Each data model has strengths and weaknesses that must be considered.